everybody. I'll wait for my circle to finish circling. I never know if this starts immediately or not. And now I know why people that do these pause before they start. It's 9:30 in the morning. It's September 11th. So everybody's pausing for reflection 19 years after that horrifying event. What we're going to talk about this morning is atherosclerosis, or hardening of the arteries. So I'll tell you a story, then I'll tell you, good morning Linda, and then I'll tell you a story, and then I will tell you the standard recommendations for potentially helping with heart disease. So people call this heart disease, hardening of the arteries, atherosclerosis. It can be symptomatic or asymptomatic. But one of the issues really for people that have survived COVID-19 is probably chronic inflammation. So there's a post-viral syndrome that's affecting a lot of people, and it's more than likely inflammatory based. And so I preach to you that chronic inflammation leads to chronic disease, and that is true for atherosclerosis. Hi, Christy. So the story is from a physician who was a cardiovascular surgeon for 25 years, who changed his tune, and I'm completely blocking his name, and I forgot to look it up before I went live. So this guy spent 25 years doing coronary artery bypass grafts, or that's known as cabbage in the medical community. So basically taking the great saphenous vein from the leg and bypassing an arterial blockage in coronary arteries, or a narrowing of coronary arteries from plaque buildup. So that's atherosclerosis. And he switched from doing surgical intervention for that to lifestyle modification. I don't believe that he's a big statin guy, but what he described when I first read about him 4 or 5 years ago was that being a surgeon, if you look inside of a coronary artery of someone who has heart disease, it looks like somebody sorry, I took my Herbisart, and so I have my dry cough. It looks like somebody took a wire brush to the inside lining of the arterial wall. So that's chronic inflammation. And theoretically, if you don't have chronic inflammation, then cholesterol isn't going to stick to an arterial wall. So it doesn't matter what your cholesterol level is, because cholesterol, 80% of your cholesterol is not eaten, it's made by your liver. It's part of your cell wall. We talked about steroid biosynthesis from cholesterol in the human physiology class yesterday, and they're starting to get the fact that cholesterol is not a bad thing. Cholesterol is what keeps you alive. So if you didn't have cholesterol, you just wouldn't be alive. So if you don't have inflammatory changes to the walls of your arteries, then cholesterol should just sail right through your coronary arteries and your femoral arteries and your carotid arteries, all the places that you can get plaque buildup. But if you have chronic inflammation or inflammatory damage, then all of a sudden the arterial wall becomes sticky. And that's how plaque builds up. And then if it calcifies, you can see that on a CT scan. So there is a cardiac CT scan. I did one, I think, when I was about 52. It's a 5-minute test you get in the CT scanner during the heart disease month of whatever month that is. They usually have them on sale for about $35 to $50. So I think mine cost me $50. So my cardiac calcium index from CT scan when I was 52 was about 212, which was moderate risk. And that kind of fits with the probably inflammatory lifestyle that I live under continuous stress as an obstetrician and covering emergency rooms and being on call. I was always kind of solo. I had some call coverage, but for the most part I was on the bubble most of the time. So traditionally, so that's the story. So post-COVID-19 people, they have a huge amount of inflammation, and more than likely, since we're seeing this post-COVID syndrome, the basis of that is ongoing chronic inflammation and oxidative stress and free radical generation, oxygen reactive species. Okay, so from Healthline, and then I'm going to tell you the traditional thing, which everybody kind of subscribes to, and then I'm going to tell you some newer research in the last 5 years, and 2 or 3 studies that have come out this year, despite everything being COVID related. Hey, Wendy, what's the weather in New York today? It is foggy and overcast. It's supposed to rain all day here. Okay, so from Healthline, and I use a lot of stuff from Healthline because they do a nice job of putting stuff together. It is usually reviewed so a lot of these are written by healthcare professionals, and then another healthcare professional reviews the article before it's published. Okay, so what's atherosclerosis? So commonly known as heart disease, okay? It can be serious and can be life-threatening. So remember, heart disease is the #1 killer of Americans. Once you've been diagnosed, they will tell you to make lifestyle changes, specifically low-fat diets and plant-based diets, and for me, avoiding carbohydrates, especially the simple ones. So atherosclerosis comes from the Greek words athero, which means paste, and sclerosis, which means hardness. And so that's why my mother, my grandmother called this, my mother and grandmother, and my dad, called this hardening of the arteries. So that's the traditional name for that. So it starts slowly, and I read a study this morning actually that showed that if you are genetically predisposed to high cholesterol, high LDL cholesterol, etc., so that's called familial hypercholesterolemia, there's not a whole lot you can do about that, and I think that's me. So my cholesterol is probably familial generated and genetic. There's not well, I guess you can probably figure that out from family history more than anything, although my family history is longevity. So there's not a whole lot of heart disease in my family. I had an uncle that died of a heart attack driving on Interstate 70 between Boonville and Columbia when he was 57. Heavy smoker, though. Heavy smoker. Unfiltered Camels, I think, was his thing. So if you have high cholesterol, eventually, if you have inflammation, that's the caveat, excess cholesterol will collect on your artery walls. So if you can live a stress-free life and never have any inflammation, you're probably good. You can eat whatever you wanted, except carbs, and probably get by with it. Okay, the body reacts to that because there's an inflammation response by sending white blood cells to attack the plaque buildup. Okay, so sort of like they're attacking an infection. So even though it's not an infection, there's chronic inflammation, and that's going to trigger your immune response. And of course, people who've had COVID-19 have an overabundance of immune response, and if they continue to have long-standing chronic inflammation, the potential for a faster plaque buildup is possibly there. So the cells die. So macrophages come in, white blood cells, etc. The cells die after eating the cholesterol, and then those dead cells collect in the artery. So we talked about senolytics, I think it was 2 days ago, about damaged cells being cleared, and there's a way to do that. I got my senolytic stuff earlier this week. It's 2 capsules 1 week, and it's kind of packaged, so it says week 1, week 2, so it's 12 weeks worth, two capsules once a week to help clear up damaged cells. So that would be one way of approaching that issue. And so the dead cells, if they're not cleared, collect inside the artery, leading to more inflammation. And so when inflammation lasts for even a longer period of time, then you get scarring. And by that time, you get a plaque buildup that is hardened and been calcified. And then the arteries become more narrow. Blood is not passing through there as well as it should. And some people eventually become symptomatic with angina pectoris, so chest pain when they're active. So they have a higher heart rate, they need more blood flow to their arterial muscle, to their cardiac muscle, and that can't happen. So the reduction in blood flow and oxygenation causes chest pain. If they sit at rest, the chest pain tends to subside. If it gets bad enough, they still use nitroglycerin pills to get rid of that. Eventually, though, some of that will collect some clot, and if there's a clot that breaks free and stops up the artery, that's called a heart attack or a myocardial infarction, so cutting off blood supply. Okay, also the way that you can get stroke. So a blockage, carotid artery, plaque buildup, clot forms, goes up into your head, up into your cerebral circulation, your brain, and that's how strokes happen. Okay, so how's it diagnosed? So I told you about a CT scan for cardiac calcium index. That's not actually that accurate. It gives you a risk percentage, or kind of, mild, moderate, no risk, mild, moderate, severe. If you really want to know if you have narrowing, you have to have a cardiac vessel study. So coronary angiogram it's called, where they stick dye up through your coronary arteries and they take pictures of it and they can see the narrowing. That's basically how you diagnose plaque. So the factors in a medical history include a history of smoking or conditions such as diabetes, type 2, high blood pressure, high cholesterol, and obesity. So you can do imaging tests, so ultrasound, CT scan, you can do magnetic resonance angiography, and they can determine the severity of the blockage, 50% blocks, 90% blockage. They can do an ankle brachial index, so they can check the blood pressure in your ankle compared to the blood pressure where it's normally checked in your arm. If there's a difference, you might have peripheral plaque and peripheral artery disease. And then there's a stress test where you get on a treadmill, you go through what's called a Bruce protocol, takes about 12 minutes, and then they can do a post-treadmill ultrasound. I have one of those at 38 when I had an EKG change, and I passed out with flying colors. But basically, or they can do a nuclear medicine scan. So they can put you on the treadmill, put you under a camera, and do a nuclear, and put some stuff in your veins and do a nuclear medicine scan, see how you're doing. Okay, so the question is, can it be reversed? So first I'm going to tell you that no, they don't think it can be reversed, and then I'm going to tell you that yes, they think it can be reversed. And this is an article that just came out from a cardiologist. So Howard Weintraub, cardiologist at NYU, says that once you're diagnosed with atherosclerosis, the most you can do is make the disease less dangerous. So he goes on to say, in the studies that have been done so far, the amount of reduction in plaque buildup that's seen over the course of a year or two is measured in a 100th of a millimeter. Okay, so medical treatment is really lifestyle and dietary changes to keep atherosclerosis from getting worse. And he says they are not able to reverse the disease. Okay, so medications can be used, so fairly frequently statins. And we did a 4-part class on statins and cholesterol, etc., in May. Statins may may stabilize a plaque, but they don't reverse heart disease, and they have nothing to do with mortality from heart attack or stroke or heart disease. They don't do anything for mortality. So I've seen, and the guy that wrote the article we're going to discuss kind of refutes the statement I just made about mortality and statins, because he's kind of a low-dose statin guy. Okay, And Dr. Weintraub is saying statins are the most effective and commonly used cholesterol-lowering drugs in the U.S., probably in the world. They block a substance in your liver that your body uses to make low-density lipoprotein, or he says bad cholesterol. Now, if you've listened to me, you know that LDL is not a cholesterol. It's not cholesterol. It's a cholesterol taxi. So cholesterol is cholesterol. LDL and HDL is a lipoprotein, so it's a taxi that carries cholesterol. It's not bad or good. There's no such thing as bad or good cholesterol. It's cholesterol. Okay, 7 commonly prescribed statins. So Lipitor is probably the biggie. Atorvastatin is the generic. There's fluvastatin, lovastatin's been around a long time. Livalo, I've never even heard of that one. Pravachol you've seen on TV, Pravastatin. Crestor you've seen on TV. Simvastatin, Zocor, you've seen that one on TV. So healthy dietary changes, regular exercise, both important parts of reducing high blood pressure and high cholesterol. And then, so they say even if you take a statin, you got to do all these lifestyle modifications. So if you smoke, you quit smoking because that can build up plaque. And again, Dr. Weintraub saying it also reduces the amount of good cholesterol, high density lipoprotein, which is not a cholesterol, it's a lipoprotein. And lower HDL has been associated with higher blood pressure as well. So increased stress on arteries. Post-COVID syndrome, increased stress on arteries. So exercise, 30 to 60 minutes per day of moderate cardiovascular exercise, losing weight, maintain a normal blood pressure, boost your HDL. That's true. Best way to do that is olive oil. They're talking about aerobic exercising, increasing HDL, and I don't think that's true. There's not like a pill you can take, but you can cook or eat with olive oil. Good fats, natural fats. Okay, dietary changes. Decrease sugar intake. To me, end of story. Decrease sugar intake, especially simple sugar. So soda, sweet tea, other drinks, anything with high fructose corn syrup in it. You have to relabel. So if it says high fructose corn syrup, don't eat it. Don't drink it. Don't put it in your body. Eat more fiber. Get that? We talked about that for boosting your immunity. Eat healthy fats. Olive oil. A friend of mine, I told you, eats 1 avocado a day. That's a good fat. 20 years that she's been doing that. Nuts are good for you. We talked about that with immune system. Eat leaner cuts of meat. Grass-fed beef is best. Chicken, turkey breast, good examples. Avoid trans fats, limit saturated fats. Well, that is arguable. Limit your sodium intake. My doctor, Dr. Blake Brooks, nephrologist, hypertension specialist, has told me if you salt your food too much, it'll raise your blood pressure. So I sort of don't listen to that advice because I, like I told him and his nurse, if I can't have salt on my food, I just wouldn't eat. So I told you the Dean Ornish story a couple, 3 weeks ago where the Dean Ornish, which is a plant-based reduced fat dietary thing that's been around since 2000, so 20 years now, maybe even longer, because I was using the Dean Ornish. I wasn't using it, but I tried it, the spaghetti and meatballs, and I told you it tasted like shoestrings with pencil erasers in it, fruit. In order to make that even go down, I had to salt it so heavy I probably raised my blood pressure 100 points on each side. Okay, if medication and dietary changes don't work, surgery is an option. So you can stent, you can have a cabbage, they can balloon angioplasty your arteries, but they have to see it first. Okay? So, yeah, Becca, we are on fire, like half of the western U.S. And windy, cooler, and less humid in New York. Very nice. Same way it is here. So cooler and humidity is horrifying here. It's not been bad at all the last. I mean, the winds change. Like I guess when I was teaching on, this is Friday, I was teaching on Tuesday. You could tell The weather was changing. Okay, so this article just came out. It's listed. It was written in August of 2020. Written by a cardiologist named Joel Kahn. He has a huge website. He's a Dean Ornish guy. He's a plant-based diet guy. I'm just going to review this article on what he thinks is a potential way of reversing atherosclerosis. So I gave you Dr. Weintraub and Healthline's version of once you got it, you got it. Potentially not true. So this guy has devoted his career as a cardiologist and ways to treat atherosclerosis. Okay, so he's relied for most of his career on lifestyle changes, diet, and supplements. So CoQ10, remember turmeric to reduce inflammation for me is supplements that are heart healthy. And if somebody's on a statin, your CoQ10 levels go down. That was the FDA forced statin companies to state that on the product insert, that coenzyme Q10 levels go down. That's one of the big free radical scavengers that you can use. It's produced in your body, but you can take it as ubiquinol, which is pretty well absorbed. And it also improves the contractility of cardiac muscle fibers. So anybody over 40, CoQ10 100 milligrams. Andrew Weil, if you've heard of that guy, Oprah made him famous. He says 200 milligrams a day. Can't argue with that. Okay, so large studies are showing that plant extracts, two plant extracts specifically, reduce arterial plaque in the carotid arteries when added to the diet, exercise, and healthy lifestyle counseling. So this is kind of fascinating. Basically, so Dr. Kahn started recommending these plant extracts several years ago, and then he reviews some of the most recent literature. Okay, so he started his career doing interventional cardiology. So it took him 7 years of training after medical school. So an internal medicine residency, then an interventional cardiology fellowship. That's actually one of the things that I thought about doing, and I did. I did an elective in interventional cardiology, and I was at Harry S. Truman VA Hospital the day that the Challenger exploded, and I was on that interventional cardiology rotation. I really did sort of think about doing that. So most of this Dr. Kahn's practice was placing stents. Okay, so he would prop open coronary arteries that had already been partially or totally occluded with atherosclerotic plaque. So the cabbage people, sometimes you can balloon open arteries or stent them as somebody is having a heart attack. It's kind of an emergency thing. But cabbages are still done, coronary artery bypass grafts. So he did that for 3 weeks and decided, okay, there's got to be a better way to treat this problem. And so he found a study focused on atherosclerosis, reporting that dietary changes and lifestyle modification reversed atherosclerosis. Okay, so what he's done since then is combine interventional cardiology with searches for lifestyle and supplements and ways of eating to stabilize and reverse buildup. That's basically what Dr. Weintraub was talking about. So he got impressed by a study. This is from, let me see what year this was, 2016. So see, not that long ago. Okay, so he was impressed by that study that was published reporting on a combination of extracts of French maritime pine bark, pycnogenol is European pine bark, and an herbal extract called Centella asiatica. Well, it turns out that either one of them will help. If you combine the two of them, you actually get reversal. So when added to a standard not American diet, the SAD diet, no, when added to dietary modification, exercise, and lifestyle counseling, those two plant extracts improved plaque stability and reduced the size of the plaque. So that first study was 50 patients with plaque in their carotid arteries. That's what supplies blood to your brain, your neck, your face. No history of cardiovascular events. They didn't have metabolic problems, insulin resistance, diabetes, or obesity, so they weren't overweight. So a 3-month study, pine bark plus Centella asiatica, reduced carotid artery plaque, and lowered the number of plaques compared to control. Okay, so he started using that as a routine. So more and more evidence mounted when a longer-term study published in 2017, 391. So the number of participants, subjects, was 391. They were followed for 4 years and then published in 2017. So all of them had asymptomatic plaques of the carotid artery, or the femoral artery, which is the big artery that provides blood flow to your leg. The lesions extended about 50% into the arteries. One of them was 60%, so that's at least in one location. They formed 3 treatment groups, one treated with extract of pine bark alone, another treated with pine bark and Centella asiatica, and a third control group with no extracts at all. They all got the same regular intervention of dietary modification, exercise, and lifestyle counseling. And then a rate of plaque progression was measured by ultrasound and significantly lower in both treatment groups. The group that took the combination of the 2 extracts had the greatest reduction in progression of plaque thickness and length, so they can measure that by ultrasound. Okay, so they had a favorable impact on cardiovascular outcomes. So outcomes. The occurrence of angina, which is the chest pain from reduced blood flow to the heart muscle, was less than 3% in 2 groups taking the extract, compared with 6.25% in control groups on follow-up, so 4 years of follow-up. The rate of heart attacks was lower for the combination therapy of the pine bark and Centella. And events requiring admission to a hospital, 16% in control subjects, no extracts, 8.9% in those using pine bark, 3.3% in those that were using combination pine bark and Centella. Okay, so he's been using this and checking ultrasound on carotid intima media thickness. So that's an ultrasound measure of the thickness and watching the plaque over time. So it measures the thickness of the inner layers of the carotid artery, and increased plaque means increased thickness of that artery, okay? And so routinely he was showing that in his practice, those that were taking pine bark and Centella have seen arterial ages drop 10 to 20 years after only 1 to 2 years of taking that combination. So they can measure like the arterial age of your arteries, okay? And then another study in 2020, just published this year. This was from Italy. 84 normal weight to mildly overweight subjects with asymptomatic atherosclerosis in carotid and femoral arteries, determined by high-resolution ultrasound, treated with similar interventions as the previous one. There was a plaque that was blocking less than 50% of an artery, and those that had more than 50% of blockage were included in that trial. Again, all patients were given diet modification, exercise, and lifestyle counseling. One group received no additional treatment, just the standard thing, no statins. A second took 100 milligrams of aspirin a day to reduce inflammation, and a third received the aspirin plus the combination of the 2 extracts, pine bark on 150 milligrams a day, Centella asiatica at 450 milligrams a day. They followed them for 3 years, and 20% of the patients that were on standard management, the first part that we talked about, and the aspirin group had progressed to more severe and extensive plaque. The patients treated with aspirin, pine bark, and Centella only had 5% with plaque progression. Okay? In the diet, exercise, and lifestyle counseling group, 22% had a cardiovascular event that put them in the hospital. The number declined to 12% in the aspirin group and only 3.5% in the group taking an aspirin a day plus the 2 plant extracts. Okay, the same research team evaluated the efficacy of that combination in patients that had coronary artery calcification. So that's what you can see on CT cardiac index score, cardiac calcium index score. So coronary arteries, those patients can have angina, shortness of breath, even have heart attacks if they form blood clots, right? So this study was 3 groups of 30 men each with asymptomatic calcifications of coronary arteries. They didn't have angina, they didn't have shortness of breath, but the calcification indicates a mature plaque that has become hardening of the arteries. Okay, so all of them received standard diet, exercise, lifestyle counseling, and took 100 milligrams a day of aspirin. The first group, no additional treatment. The second had 150 milligrams a day of pine bark extract. The third used the combination of pine bark and centella. They followed those for 1 year. 35% increase in the number of coronary artery calcifications in the group that received diet, lifestyle, and exercise counseling plus aspirin. In those taking pine bark alone with the aspirin, new calcifications halted, they stopped. And then those using pine bark and centella, there was a 10% decrease in the number of calcifications. Okay? Alright, then another one, the impact of pine bark and centella on plaque progression in arteries that had been stented in 160 patients, determined by ultrasound, grouped into 3 treatment arms. So it began 6 to 10 months after a stent was placed. They were followed for 1 year. They all received dietary, exercise, and lifestyle advice, as well as an antiplatelet medication, Plavix, probably amyloidostatin. So now they're adding the statin. And aspirin's antiplatelet as well. Second group received, in addition, the pine bark, and a third group received both pine bark and centella. And after a year, progression of, this is amazing, atherosclerotic lesions on the inner arterial walls occurred in 6.7 times more patients in the diet, exercise, lifestyle, statin, and aspirin or Plavix group. Factor of 6, almost 7 times higher. Okay, compared to the group that also received the combined pine bark and centella extract. So 7 times less calcification and hardening in those patients. In fact, 60% of the patients in the group that did not receive the plant extracts had marked progression of atherosclerosis. And then by contrast, the subjects who received additional pine bark extract without centella, only 18.5% progressed, but most remarkable of all, the pine bark and centella extract groups, only 8.9% of those patients had progression. Okay? So basically the summary is the combination of French maritime pine bark and centella asiatica slows and may reverse the progression of atherosclerosis. So significant reductions in adverse cardiovascular events leading to hospitalizations. The combination seems to be the promising part of this whole study and article and everything he's talking about. So the traditional thing, even with a statin, didn't do this. Okay, so you do the lifestyle thing. So Dr. Weintraub, true on the lifestyle modification, not smoking, don't drink too much, watch what you eat. Dr. Kahn is a plant-based diet person, and to me that would be very difficult to do. I'm just not vegan, I can't do it. So we did this we're about 34 minutes in, but that's the newest research on atherosclerosis buildup and heart disease. So that's pretty exciting. I'll put you up the names of those in case nobody wrote that down when I get done. And you all have a great weekend. It is now feeling like fall, even though legally it's not fall yet, but it feels like it. So have a great weekend. Peace and health to all of you, and I'll talk to you Monday morning. See you later. Bye.